Now that schools are discussing in-person learning and more businesses are allowed to operate indoors, are Valley hospitals concerned that we may see another spike in coronavirus cases? I spoke today with Eisenhower Health's Chief Medical Officer, Dr. Alan Williamson. Dr. Williamson, it's great to see you again. Thanks so much for joining us.
Thank you, Peter. Good to be back.
So what's the latest at Eisenhower?
Well, everything continues to go very, very nicely here. We're in fact down to 0 patients in the intensive care unit with COVID right now. So we're very happy with the trend that we're seeing. Fortunately, even after Labor Day, we have not seen, at least so far, any significant uptick in the number of cases. So we're hopeful that that will continue.
What about flu cases? Are you seeing an uptick in that?
No, we've not seen a significant number of flu cases yet. We are certainly concerned about what that's going to add to this pandemic issue that we've been having, since the type of therapy that we employ in patients with serious flu cases parallels very closely what we do with the patients with COVID, requiring in some cases intensive care units, ventilators, certainly respiratory therapy, and so on. So it's obviously a concern that if we do get a heavy flu season on top of COVID, that's going to put quite a bit of stress on the health system.
Riverside County has officially moved into the red tier of the reopening process, meaning that indoor gyms, indoor dining, and more can reopen at a limited capacity. Are you worried that this may drive a spike in cases, or do you believe that we're better prepared this time?
I certainly hope that we're better prepared as a society to really understand that it's still critical that we maintain the social distancing, the hand washing, and face coverings to protect ourselves and our families and our community. It's obviously critical that we do try to reopen our economy and get our businesses back into business. And so I do understand the importance of doing that, but it's still very, very critical that we be aware of the fact that the virus is still here in our community, and that if we let our guard down, we could be in for a significant uptick in the number of cases.
Well, right now, local school districts are starting discussions on when to allow children back into the classroom with hybrid learning. I'm curious to know what your thoughts are on this. Have you had any discussions with the school districts or any advice to share with them?
I haven't personally had any discussions with the school district. Again, I understand the desire to really get moving with trying to get those kids back into an actual classroom setting. Just as we do with the opening of business, it isn't that we can't do that. We need to do that, and we will do that. It just needs to be done carefully and in a stepwise fashion with a pause each time, so we see, is this working? Are there issues with this? Do we need to back off, or is it safe to proceed? So I think the current plan with the tiers and so on is actually a pretty well thought out plan, where we really, I know it's frustrating for people that it seems like it takes a long time, but there's a reason behind that it does take us quite a little bit of time to really see the impact of interventions that are done both positively and negatively.
The CDC posted guidance on Friday and then removed that guidance just days later regarding coronavirus spreading through aerosol particles. What do you make of this? And do we know if the virus does in fact spread through the air as well as droplet particles?
I can't speak for the CDC directly, but I suspect the confusion was really a semantics issue. So we need to be careful about really, are we talking about an airborne illness where it really persists in the air for long periods of time versus a disease that is spread through the air? Now, droplets spread, obviously the droplets are traveling through the air. So in that sense, it is airborne, but it is not an airborne disease that is persisting for long periods of time in the air. I think that's where the confusion was. Now, this virus is a little different than some other droplet spread diseases. It's a bit of a hybrid between an airborne illness and a typical droplet spread illness that we would be used to more traditionally. And it's why we've always had a combined isolation procedure for these patients. They really are treated, at least in the hospital, essentially as if it's an airborne disease anyway. So from a healthcare standpoint, the differentiation is not terribly critical because we've already been treating it that way. But I think that the perhaps the reason for pulling back so abruptly was just the fear that that really leads to in the general public, that this is now just spreading through the air everywhere we go and nowhere is safe.
All right. Dr. Williamson, as always, we appreciate your time. Thanks for joining us.
Thank you, Peter.